as most of you will know, the Palliative Care Sustainability Network launched last year our Greener Palliative Care Award scheme, which we're currently running as a pilot. And what we are aiming to do is to reduce the environmental impact and carbon emissions from our sector. So we picked as a first theme for sharing practice and learning from that scheme to start talking about how you communicate with your teams. And it seemed like the obvious place to start, right? The first thing you have to do, and it's across our bronze section of our award as well, is to start talking about the changes that might need to happen. So that's why we've gone with that first. We've got 3 speakers today who are going to share with us a little bit of their experience. The first is Paul Harris, who's the Head of Facilities and Sustainability at Phyllis Tuckwell Hospice in Farnham. And Phyllis Tuckwell are one of our pilot sites, and they are aiming for gold in our award scheme. So I'm really looking forward to hearing what they've been up to. Paul, don't look so worried. It's going well. And then we're going to hear from some of the team from Getting It Right First Time, who are going to share with us some of the learning and reflections they've had on communicating around sustainability. And then finally, we're going to hear from Liz Baker, who's been a journalist for 15 years and has worked in NHS communications for around the last 6. And she was going to share with us some top tips for how we communicate effectively as well. There will be time after each speaker for maybe 1 or 2 quick questions, and then hopefully around 15 minutes at the end for a little bit more of a discussion. Please do put questions and comments in the chat, and I will try and keep an eye on that and collate things and sort of put that towards the speakers at the end. And yeah, do introduce yourselves in the chat and have a bit of a conversation in there as well if you want to. So no more talking from me. I'm going to hand over to Paul, who will start to tell us about what they've been up to at Phyllis Tuckwell. Paul, over to you.
Thank you. So you're not having to just listen to me for 10 minutes or so. I have done a little slide pack together to sort of break up the monotony of me talking. But the emphasis from myself is obviously focused on Phyllis Tuckwell and what we are doing in terms of and what we have been doing and are going ahead doing, talking to the teams within the organisation about sustainability. And obviously our focus in the last 6 months has been very much being part of the Greener Palliative Care Award pilot scheme has given us a great tool to communicate that better. So I'll just share my screen now and just check you can all see it. Okay. Can you see the screen?
Yes.
Yes. Okay, thank you. Okay, so I'll move from the cover slide to the second one. The first thing I wanted to talk about was just generally understanding sustainability within the organisation. I think what we found over time is it's easy to assume that everybody understands what sustainability is. And I think it was quite clear when we started discussions within the organisation that actually not everyone understands what sustainability is, and there was quite a considerable view that it was just to do with utilities and utility companies and not necessarily other elements. And it was also trying to understand that there are numerous different types of sustainability, some that we can have the organisation can have an influence on, and some that the organisation can't. So it was really trying to get that message across as what sustainability covers, making it very sort of clear, precise and easy to understand across the teams in the organisation, and really what the organisation can have an influence on. So there's elements of sustainability, political, cultural and things like that that the organisation can't have an influence on, but it's very much focus on what we can impact. It was very important for us as well to relate sustainability to us as an organisation, and what individuals can do in the workplace, and potentially then take it forward into their private lives. And again, very much about communicating it as much as possible, not in front of people continually, but to make sure they're aware of what the organisation is doing, how we're planning to go forward, and what our targets and goals are. And then the second slide I've got just gives you some idea. These are some of the internal slides that we've produced as part of presentations. So it's very much an outline on sort of what is sustainability and how it affects our hospice specifically there. Moving on a little bit, one huge advantage for us, which I know every organisation is different and will have different opportunities here, but basically we have knocked our hospice down and are building a brand new one at the moment. We're about a year into that process. We've got the rest of this year to go, and then we'll be opening a brand new hospice. Now, in some respects, that has made it much easier to communicate the sustainability message, because we are building a hospice with sustainability at the forefront of that process, and also involving staff along that line. So it allows for great staff and our external community engagement with all our communication about what we're building at the hospice and how we're building a sustainable building going forward, as well as how we're planning to operate it going forward. We found that sort of very early staff involvement during the whole design process. We were designing our new hospice 2 years before we demolished the old one, and it was very much bringing everyone on board as to how we wanted to design that and how we wanted to bring sustainability to the forefront of the design of the building. A sustainable building gives you a great message to get out there, both with your staff internally and externally. And we've done an awful lot of presentations internally so that staff are fully aware of what our proposals were, and also our community, our local community, to understand our sustainability goals. And obviously, being a charity, it's vitally important that our costs are controlled and measured, and obviously sustainability feeds into that quite heavily. And from our perspective, in terms of fundraising and funding for our new hospice, it's a great message out there for trusts and other funding opportunities. So again, I've just put a sort of little slide pack there, which shows you some of the presentation slides that we put together. So it's very much focused on a sort of summary of what we were doing initially, targets that we were looking to achieve that are partly controlled by planning departments, in terms of what they call TER, sort of target emissions rate now, which with any planning application is standard. Our design allows us to achieve that and hopefully do better than that. And so again, another good message externally. And then we looked at sort of from a building perspective, very much looking at all the renewable technologies, and for staff to understand the decisions that were made along the way as to what was viable to use on a site and what wasn't viable to use on a site, and historical issues that we had at the old hospice of overheating a building that was not designed fit for purpose, and all those things have fed into the decision as to how we design and build that hospice. So a great opportunity for us. I know it's different for other people and it'll be different messages, but people have refurbishments, developments and things like that as well, and I think it's a great opportunity to be able to get that message out there and incorporate that into the design. Just moving on to the Greener Palliative Care Award scheme, again, it's a communication that we has gone a huge amount internally for staff to understand what we're planning on achieving. So it's been a huge positive impact for the hospice to be chosen to be part of the pilot scheme, and it's worked extremely well at focusing people into the need, but also very much has created a framework for us to base all our plans on. So that framework can be communicated to each and every team and department and how it affects them, and then also gives us sort of targets to work to between the bronze, silver and gold options there. And again, another reason to keep talking about sustainability. We've very much got a feeling now across the organisation that there's a responsibility and ownership to achieve the award. And I think it's fed extremely well into that framework, and giving us a sort of structured approach to how we approach it going forward has done fantastic for the organisation. And it enables us to set our targets, to look at progress and set our achievements and report on during the process of us going through the award scheme. And at the end of the day, if we achieve a reward, whatever level, it's something for us to shout about internally for staff to feel proud of it, but also externally. It's a huge talking point out there from funders, our community, and ensuring that we are building a hospice that's fit for the next 40, 50 years and is as efficient as possible and having least impact on the environment. So alongside that, we have our sustainability committee. It's something we've had running for a number of years. It used to be called basically the eco committee. But again, the opportunity of the award scheme has allowed us to sort of focus and framework that. It was I'd say a little bit lost previously. There was not a sort of direct plan as to how to frame the eco committee as such and what sort of impact they were having. So the sustainability committee, focusing with the award scheme running along parallel, has given us great framework to work to. And the committee, we've set ourselves target of basically make our things achievable. Don't make them non-achievable, because if you don't, you switch people off very quickly. One thing I've learned from previous roles I've had as well is basically when you're looking at sustainability, don't remove things, offer alternatives. Now, an example I would use of this is I come from a school background, and one of the things that everyone thought was a great idea in the first place, let's have a meat-free day. What it did, basically switched the students off straight away. There's no option. I don't want meat. I don't want just the option. But to give alternatives and promote those alternatives means you're not taking something away, and that still then creates a positive message rather than a negative message. When you're looking at people's jobs, don't make something more difficult for them. If you're changing something, don't make it more difficult for someone to do something, or they won't do it. They'll switch off to it again. And again, targets that you set, they don't have to be big targets to change. The big ones are much more difficult to put in place. Little changes grow into big changes. Basically, those little things across the board, and everyone starting to do them, can make a bigger difference over time. Again, it's communicating the benefits, the achievements that have gone on during this process, and again, keeping regular communications, keeping sustainability in people's minds and at the forefront. One of the tools that we use, we have our internal intranet, which staff can put a lot of information on, and obviously sustainability is one that we keep information flowing there. It's looking at how we keep that information fresh and new for people. And so one of the things we've been looking at is, let's communicate some of the bigger issues. It could be worldwide, it could be just UK based, it could be very local. But what those issues are, obviously they've got to be factual and you've got to be able to support them. But then we can follow that up then with what we can do, what we as an organisation can make a difference to there. And that then I think just helps keeping the message out there and hopefully keeping it fresh all the time, which I think does help with us. And relate work changes to opportunities outside of work. So the things that you are instigating in work, are there opportunities to do those in the home environment? Because the more we spread that, the greater the opportunity to have a bigger impact overall. So that is about it. Thank you. And a little thank you slide. There you go. I shall stop sharing.
Thank you so much, Paul. That was fascinating. Really good to hear you talk about it. Lovely. Right, we've got maybe a minute if anyone's got an immediate question for Paul. But if not, I will let you kind of mull over that and start to draw the links between what some of the other speakers will say as well. And we will hopefully come back to Paul at the end. And I can't see anyone's hand up, so we will move on. So we have both Keith and Joe joining us from the Getting It Right First Time programme. So I don't know which one of you plans to speak. So
I've got some slides, so I'll share those That's right.
Lovely, great. Hi, Joe.
Thank you.
Joe
Hello,
and Keith and
Adrian.
I have only met via email, so it's nice to see you.
Yeah, you too. Yeah, it's got a great group of people here as well. Nice to see so many people dialed in to talk about sustainability.
It is, and we've had lots of requests for the recording as well. So yeah, we've had a lot of direct emails saying, I can't make it, can you record it? So that's exciting.
That's fantastic. Yeah.
Brilliant.
Great.
I will
So,
shut up.
yeah,
Go.
thank you for the invite. I'm Joe. I'm a urology registrar in the Southwest. Been a GIRFT fellow for 3 years, and now I'm leading this work on sustainable care pathway development through the Getting It Right program. And Keith, William Keith Gray, but we call him Keith, is on the call as well, and he's the academic content lead for GIRFT. I've been working really closely with him and a few others. So yeah, this is really about reflecting, I suppose, on the work we've been doing and how communication has sort of been an important part of that. It's really sort of GIRFT is an operational program. I'll explain a little bit now. But we're kind of doing research alongside that, so kind of delivering improvement and research at the same time. And we've sort of approached communication iteratively, and used the networks we've got available and sort of done our best with it and learned as we've gone, really. So this is about reflecting on that a bit. So a quick background on GIRFT. So if you haven't heard of it, it's a national quality improvement program. It's all about improving care and efficiency, reducing unwarranted variation in care. Some defining features: it's clinically led. So each of the work streams, we've got about 42 work streams in medical and surgical specialties. Haven't got one in palliative care, I noticed, but we've got it in most areas. But they're led by experienced consultants, which is sort of quite unique compared to some other quality improvement programs nationally. We use a lot of data benchmarking, and every lead visits every hospital in the country, so they get a really good understanding of what's going on. Strong focus on implementation and on care pathway redesign. I've done a PhD with the GIRFT program and the University of Exeter, and this was first looking at implementation of GIRFT's recommendations, and we were interested in this kind of synergy between efficiency and sustainability. But what we realised as I started doing some early work there is that there's potentially a huge opportunity here for a national clinical improvement program like GIRFT to support sustainable improvement in clinical delivery. So, and the PhD ended up being all about that, and we've built that into a program of work now. And this is why we think GIRFT is useful in this setting. It's because we've got a lot to consider basically when it comes to decarbonising clinical delivery. So we've got the need to decarbonise rapidly, and we know that substantial decarbonisation in the next few years is much better than doing it much nearer to 2040 or 2045. The planet suffers a lot less as a result, and so do we. But then we've got all these other things to think about in terms of health delivery. So this is about as complex a problem as it gets, I think, when it comes to decarbonisation. And so we think we need a clinically led approach to this, which really accounts for all of these things. So we think we need to think about context. So we can't just apply principles broadly. You need to think, what's the actual setting that I'm applying this to? And that's in order to achieve impact and scale, and also having a national program can help with that, because we can share good ideas, best practice, and innovation. And so to drive that, I think what we need is a clinically informed approach. We need patients involved, and we need to use evidence that's available to us. And what we've done is looked at pathways, because for a few reasons, you can find multiple things that you can change across those pathways to decarbonise them. And it gets away from this tendency that we have by looking at a whole pathway and finding multiple things to sort of adopt single action bias, where we really want to just focus on one thing. What's the one thing I can do to save the planet? There is no one thing. It's a complex problem with lots that we need to do to fix it. And so taking a broad pathway approach can help with that. So we've developed this methodology. I won't go into it in too much detail, but I think the fundamental tenets that do kind of feed into the communication side are it's the co-development with clinicians and patients, as we produce recommendations for how to decarbonise a specific care pathway. We think that's important, and I'll touch on that again in a minute. And then it's using data as well, because data can tell us where our big priority areas are. And that's what we've done with our pathway approach. We basically map out all the clinical activities, map onto that all of the different decarbonisation interventions that we could introduce, to then model where the big hotspots are that we can modify. And that's what this Pareto graph down in the bottom right shows. It's essentially all of the different things we could do, and then what the decarbonisation benefit is. So that's a key part of our approach as well, which we think is important in prioritising our efforts, and then being able to communicate why those things that we want people to change are of value. But yeah, this is basically a description of our ELA framework methodology, which is environmental lessons learned and applied, which is what we've developed and are now rolling out across multiple care pathways. So this is the sort of unit of intervention that we've developed for how we want to address the the sort of issue of clinical transformation towards more sustainable care. We're producing at the moment these pathway-specific delivery guides. And those will obviously go out to the relevant teams. So this pilot pathway, which we've published on the GIRFT website, is about bladder cancer care. And so once again, thinking about communication, we think this is quite useful because what we're doing is essentially we're doing all the hard work around applying sustainable principles to a particular setting, so bladder cancer care here. And then we can deliver a very sort of clinically focused guide to urologists, urology nurses, oncologists, and managers who can then set up the elements of that service that we think are important in driving down carbon emissions. So that's what we've got, and we're now going to be doing this for lots of other pathways. We're going to publish shortly a hip arthroplasty guide, and then we've got about another 4 or 5 that we're hoping to do over the next year. This is inside the guide, so this is our top 12 recommendations that we focused on based on that Pareto analysis, where we took the highest modifiable carbon hotspots. And then this on the right hand side here is what a page in the guide looks like. So this is in clinical language. So this is about delivering same-day preoperative assessment for patients who need a bladder tumor resection operation. So what we've tried to focus on here really is directing it towards clinicians, using the language that clinicians will understand, so that it can be interpreted easily. We're avoiding sort of too much jargon in the way of sustainability, and no need for anybody to understand life cycle assessment or modelling or anything like that. This is purely clinical guidance. And then producing sort of flow diagrams such as this one here for how to triage your patients and select who could be potentially assessed remotely with a telephone consultation versus who needs to be seen on the day because they're higher risk. So trying to produce supporting sort of guidance and flow diagrams and pathways to support the changes that we want to deliver. And the other bit, we've got a bit on benefits, which I'll come back to in a second as well. So thinking broadly about communication, just sort of zooming out a second, we've been interested and worked with some behavioural scientists alongside this pathway development work that we've been doing. And I wouldn't say that this isn't necessarily a central part of our approach, but we've paid a lot of attention to these behavioural change frameworks and used them where they've been kind of useful, or at least as a tool for filling any gaps or identifying gaps that we think we might have missed when making recommendations for decarbonising. So this is the behavioural change wheel. In the middle, you've got the COM-B framework, which covers capability, opportunity, and motivation, which is basically these sort of tenets for how you might identify reasons why a behaviour is or isn't taking place. So as well as working up our guidance recommendations with experienced clinicians from multidisciplinary backgrounds from across the UK, we've then also used this to sort of fill in some gaps. And I suppose what these frameworks help you to do in simple terms is just think slightly more specifically about what you're asking people to do differently. So why are we doing it? Making the case is important. What do we want them to do? Who's going to do it? How are they going to do it? When and where, so in what circumstances. So we're really trying to drill down, and that's the essence of what we're trying to offer with those these guidance documents is what's the headline message for decarbonising care, but then what are the particular sort of circumstances in which you're going to deliver that, and when wouldn't you deliver it as well is important. And we think that it's that kind of clinical nuanced messaging that is important to really get these changes up and running. Another reflection I've had on while we've been sort of taking this work on the road, once we produced the guidance, is really about sort of what metrics or what ways of evaluating the change matter to whom. So I've sort of just mapped out here, national, regional, local, departmental, team, and individual actors. If we want to get sustainability right, we need to be addressing organisations at all of these different levels, but different outcomes and metrics might be valued differently by those individuals, and we have seen that. So for example, if you're talking to an individual or maybe even a team, they might care about carbon, they might not, depends on their sort of view on climate change and their priorities. They probably don't actually care about cost, is my experience. So when you're treating a particular patient, you probably don't care too much about how much it's going to cost. You want to do the right thing by your patient. They probably do care about the patient's experience, maybe their own experience as well. They might care about efficiency, I think, depending on whether that's their own experience of it. But we know that actually a lot of our pathways in healthcare are quite inefficient, and it's the patients who pick up the sort of inconvenience of that. And we don't always see much of that as clinicians. They're going to care about patient outcomes, and they might care about global outcomes, planetary impact. If you're talking to somebody at a national level, maybe who's leading, a large organisation focused on change within cancer services, well, they might or might not care about carbon. It's certainly not the main thing that drives their daily work. They will really care about cost. they might care about experience, they'll definitely care about efficiency and patient outcomes, and they might care about global outcomes. So there's kind of a difference in I think how people value these things, and you can't simplify it according to these sort of different regional or hierarchical levels. But I think it's just a reflection that you do need to sort of evaluate the changes that you're trying to make quite broadly and know how to pitch what you're trying to how to pitch sort of the change you're trying to make differently to different people. That's definitely something we've experienced. So to quickly run through this now, because I think I've talked for too long, but these are some of the key tenets that we sort of employ when we're delivering our guidance and developing this work. So co-development is really key, so that you've got co-ownership of whatever you do. And so we work really closely with lots of different associations and charities when we're developing this guidance, and really everything we do kind of floats on that co-development, because then it's endorsed professionally, and it's liked, and it's sort of taken seriously, and it's adopted. I think if it was just GIRFT making these recommendations through NHS England, you'd have much less traction. Clinically pitched, I've talked about that really, but delivering what you want to be done in the right language for the individuals who need to make that change is key. Carbon emissions, there's a lot to explore here, and we've explored it to an extent, and there are different ways that I think you can communicate around this. One thing to say is I think it's good to have numbers where you can to back up the change you're trying to make. And then if you can in some way communicate the importance of those numbers, that's good. But actually, our understanding about what carbon emissions sort of translate to in terms of human harm isn't fantastic, because it's a non-linear sort of correlation. And so that can be tricky. And I think sometimes it's better to think about sort of performance management and audit and feedback, which is something that we've done for our bladder cancer guidance. We've actually done a national audit now, which means we can give carbon emissions data back to hospitals and give them specific excess emission reports based on their own activities. And so where we can't necessarily draw easy links between carbon emissions and human harm, we can say, well, but this is what you could address by changing your practices. And so why don't you go and do it? And sort of potentially bringing an element of benchmarking and competition into that can help as well. And just as an example here, I've got two different anonymized audit feedback graphs from different hospitals. So you can see from the audit we've done that the emissions are very different for different hospitals. So we think there's value actually in this kind of process, because we can actually target interventions in specific units that we need to take place or are most important. Co-benefits is important. We've actually part of an NIHR and UKRI grant, which is looking at health co-benefits of decarbonising health and social care systems. We think that is really important. And I think that's actually that's one of our main priorities really over the next few years, is really understanding not just about carbon emissions reductions, but other environmental impacts and the harms that are mediated through those. And other potential benefits associated with making our services more efficient and decarbonising them, because that's going to be really important for making the political case down the line to continue with this work. Cost is also a huge thing. We think we could save about £32 million for our bladder cancer pathway adjustments alone. So we're definitely going to be driving that, because, as I said, I think that's one of the main things that matters to sort of the NHS at a regional and national level, and a trust level as well. So we're going to carry on with that. And then networks. Oh no, sorry, yeah, I'll skip past that. But then networks, I think, is the other thing. So just because we're a national organisation, we've got this ability to tap into national associations and so forth. And as I said, they're really crucial in driving a lot of these changes. But we've also got regional and local networks, sort of cancer alliances. Green NHS has regional teams as well. And then you've got your sustainability teams and your green plans and green champions within trusts. So we're really trying to engage all of those as much as possible. And I'd say we're really in the early stages of determining which elements of those really work, or is it just about trying to get as much publicity and as much attention and awareness raised as possible. So we're still really learning in that respect. So just lastly, going forwards, the things that we want to develop around communication are case studies, because I think having those examples of where things have gone really well is important. Which communication strategies work and for whom? We're going to investigate that. I've talked about wider environmental impacts and harm evaluation. I think that's key for this. And we'd like to then feed that into a holistic evaluation framework where we can look at carbon cost, human health globally, patient health as well. And there's a lot of health economists who are interested in that area. And then I think the other thing is, where's the overlap between behavioural science and expert insights? Because we've actually got a lot of mileage out of just getting the right people in the room, clinical experts from across the UK. So, but how can behavioural science approaches actually improve that as well? So those are just some thoughts, probably a bit rambling, which I'm sorry about, but happy to take any questions at the end or now. Thanks.
not rambling at all, fascinating. And yeah, really looking forward to hearing how it all goes as well.
Thank you.
So same as with Paul, has anyone got any immediate burning questions? Can't see any hands up or anything in the chat. So no, right, I will give you time to reflect and we will move on to our last speaker, who is Liz Baker. Go ahead, Liz, the floor is yours.
Marvellous, thank you very much. While I find my slides and attempt to load them up, I will begin with my usual apology. Working from home, currently surrounded by sleeping dogs. If you hear snoring, I apologise. If they wake up, then maybe barking, then I apologise for that as well. But hopefully they will all stay sleeping and it will be beautifully peaceful. It is thinking about loading.
While it's thinking, I'll share that I usually have to apologise that if one of my cats is in, he bites me when he's hungry. So I usually have to apologise that if I start wriggling, it's because I'm being bitten. Yeah.
Perfect. Can you now see some slides, or a slide, hopefully?
Yes, we're good to go.
Excellent. Thank you. So this is a bit of a whistle-stop tour through some principles of communication. I could do a whole day or more than a day on most of these slides, so apologies, it's really quite quick. The basics for communicating anything really is storytelling. Storytelling isn't just for children, it is how humans have communicated for hundreds and hundreds and thousands of years, how we pass on information and how we create a message that resonates with people and an emotional connection. Stories are easier for people to understand. You can craft a story ideally in a marketing term where the audience can imagine themselves as the main character. I know with sustainability, a lot of your work is around data. If you can turn that data into stories, a lot more people will understand it. So you could say the Earth's temperature is rising by X degrees, sea levels are rising by X centimetres, there are X numbers of extreme weather events, or you can tell the story of a family who's lost everything because of a tsunami. And I think most people will remember the impact of the story of the family than the data and the statistics. That works on a smaller scale as well. So as a trust, as all NHS trusts are, working to reduce their carbon footprints. That can be quite daunting for people if we say we need to reduce it by this amount. But if we can tell stories, if we can say, here's one team, here's what they've done to change things, then that will hopefully motivate others. I know we've seen these questions on another slide earlier, thank you for that. So they're slightly different in this context, but the main point is the same. All stories have these questions and they all need consideration when you're putting together a message that you want to share with people. So we will begin with why. Why do you want to communicate? That is actually almost more important than what you actually say. Generally, you need to be thinking of a problem that you want to solve. And in order to solve that problem, you need people to know something, or you need people to feel something, or you need people to do something. Sometimes all three of those. So it's really key to first begin with identifying the problem that you were trying to solve. So for example, at the moment here in East Kent, we are working with the rheumatology team who want to upload some FAQs to the website to stop people calling. So the idea is that the questions will be answered on the website. People won't have to call in and ask the questions, but they've written 7 pages of questions. First one of which is, what is rheumatology? I can almost guarantee nobody is phoning rheumatology department to ask, what is rheumatology? So we really need to again look at the problem. If the problem is people are calling, you don't have time to answer their questions, you need them to find the answers elsewhere, then you really need to look at the questions they're actually answering, not just what the information that you want to share. It needs to be linked to the problem. If we are thinking about what we want people to know, the idea here is often to build trust and credibility. We are always asked as a comms team, can you raise awareness of our service? Can you raise awareness of this? Well, of course we can, but what does that actually do? That doesn't solve a problem particularly. We need people to usually take action. We need them to remember. Perhaps we get them to remember by getting them to feel something. You need them to hopefully feel the right emotion. So I've put some here on the slide that you might want people to feel. You might want to feel enthused or motivated, that they are empowered to do something. Hopefully you won't overwhelm them, but that's again worth considering if you're using a lot of data. How are people feeling when they are receiving this message? And then what do you want them to do? This is your call to action. That's really important. It kind of finishes off a comms message really nicely. So do you want them to sign up to a newsletter? Do you want them to speak to a colleague and pass that message on? Do you want them to join a network? really helps if you can have something concrete that they can do as a result of having absorbed your message and having felt the emotion that you want them to feel. Then they are enthused to act. So what can they do? So if you can answer those questions, then that will help you work out what you need to say. Say what do you want to say? This is probably too small for you to see, but it's just a snip of a comms plan that I have done for Veteran Aware, which is a programme that I think almost all NHS trusts have signed up to around communicating with veterans, letting veterans know the services that are available to them, that they shouldn't be disadvantaged, letting our staff know what they can do around Veteran Aware so that we can help people who have served. The idea of showing this to you here is that what we do is we separate out our audience and we separate out our messages for the audience. We need to have a key message and then we need to have sub messages. That again is a whole other training session on how to put together a comms plan, how to identify your key messages. But that's just a kind of a visual example here. We've segregated our audience for this into patients, public, partners, as well as staff. We have messages there. We also have channels that we use, more of that later, and then barriers. So often when we're doing a comms plan for internal use, the barriers are that people are too busy. They're too busy to read millions of beautifully crafted emails with wonderfully composed messages that will help them feel something and want to act. They're just too busy. They're going to just delete it. So that's a barrier that's also really worth thinking about how we're going to communicate with people, how we're going to address those barriers. And plain English, again, I've delivered whole training sessions on plain English. People prefer it. Research suggests that comprehension improves by, I think, from 10 to 15% to more than 100% when you use plain English. That means that you get fewer questions, also means you get fewer complaints, so you don't have to spend time dealing with them. I worked previously at council and we plain Englished our council tax bills, and it really helped with people understanding what the money was for and not phoning us because we've done it in too much jargon. It also does feel friendlier, which can be really important if you are trying to get people to come along with you on a journey. Again, which helps us how people feel. So the other questions: who, how, when, and where. Who is your voice? By voice, tone of voice is a separate thing. By voice, I literally mean here your spokesperson, really. Who is delivering the message for you? Research suggests that people trust their line managers most if they're receiving messages, but again, they're super busy. They have a lot of messages that they have to impart. A lot of them are going to be clinically significant. So messages around sustainability can be pushed to the bottom, can be lost. They also may not be best placed to answer questions on some of the more technical issues of that. So you can help that by creating a sort of a comms pack that you can give them, which will have FAQs that they can use to talk to their team, or you can take a step back and try and deliver it on a wider basis, having a sort of a trust-wide spokesman, head of sustainability, director of something. I would just say choose wisely if you're doing that. If it's something that you want someone empathetic and human to deliver, please try and pick someone who's empathetic and human, also knowledgeable and enthusiastic. Hopefully there are people working within sustainability in your organisations who meet those boxes. Also your audience. Really, you need to work out who you are talking to. All staff is an audience, absolutely. But if you're thinking about what you want people to do, it's easier to sort of segment that down into which particular staff you're talking to. Are you talking to clinical staff? Are you talking to non-clinical staff? Are you talking to people managers? Are you talking to lower bands? When you worked out who you actually want to talk to and what you want them to do, then it's a lot easier for you to craft those messages. Then you work out where they are and how to reach them. This needs to be online and offline. I know the NHS loves a poster, so posters are always really good. Emails can be forgotten. Face-to-face is the best way, but again, it's really difficult to deliver. Accessibility is really important. For us as an NHS trust, there are legal requirements around accessibility. Again, a whole other training session, but these are things like the reading age, making sure that things are translated if they're online, making sure that we use alt text if we're using images and things. So do consider that if you're putting together a website. Consider physical and digital spaces where people are. We do have a staff social media presence. It's not as big as our public facing, but it is a really good space that we can talk to staff for messages that we are not really relevant to the public. And timing is also really important. If you do it too early, then there's potentially no clear call to action. There was a poster outside my office yesterday that said, Are you bored of boring lunchtimes? Do you love to sing? Choir coming soon? But there was no information. So that really, I would say, was a bit too early to put that message out. I would wait till you could say who's organising the choir, when is the choir meeting, where is the choir meeting? I'd really like to join the choir, but there was no call to action. There was nothing I could do to join that choir other than go, oh, there is a choir coming. I need to now be scanning every poster I see for the next 2 weeks in case there's another poster that says this is when the choir's meeting. But equally, if you leave it too late, they may have found out from other means, and that can be something that you want to avoid. Ideally, you want to have your message delivered in the way that you want it to be delivered, not as a kind of grapevine piece of gossip. Here is one I made earlier. This, helpfully, was the front page of our staff newsletter last week. So on the face of it, it is a story about funding for electricity submetering in one of our hospitals. We have got 5 hospitals, so this is a start. It's a pilot project for us to work out so that we can see where we're using the most electricity, what we're using it on, and then we can work to tackle that. And we've also got some funding to decommission nitrous oxide manifolds. But actually, the message here is a little bit different from just here is some news that's good around decarbonisation that you want to know. In terms of the questions, when we put this out when the funding was confirmed, how and where. This is our electronic staff newsletter. It's sent out to 11,500 staff. It was the front page of our intranet. It was on our staff social media page as well. So a little bit more of a look into that story. I would say that this was the angle. Dan is our head of sustainability, and he is very keen that people feel that they have the power to make suggestions around sustainability and what we can do as a trust to reduce their carbon footprint. So that top quote is a line from him. He really wants to empower people to suggest ideas. That's a very clear call for action. People hopefully will feel motivated, will feel empowered here. There are some other quotes there that he says everyone can be in a position to make decisions for the benefit of patients and to limit our image of the environment. And the ultimate aim is that we don't need a green plan, that it becomes really business as usual, that we're considering sustainability in the same way that we're considering cost, in the same way that we're considering effectiveness when we're working on any kind of project. It shouldn't be a separate project. It shouldn't be that we've got a head of sustainability. It should be everybody who's working to tackle sustainability as part of their day-to-day work. And again, his email address was in that story so that you could read it, you could feel empowered, you could feel enthused, and then there's a very clear call to action. He's keen to hear from you. Here's his email address, pop him an email. I don't know if anybody has. I need to catch up with him, but I'm hoping. We do have a lot of staff who are very passionate about this, so I'm hoping that there will have been some really good ideas put through to him. This again is one from a different trust. I'll pop the link to this one in the chat so you can read it properly. And this was an external story that they've done. They are using reusable hemp theatre hats here. So again, they've taken what can be potentially quite a dry story and they've really humanised it. There's a lovely picture of theatre staff here wearing their new reusable hemp hats. You can see that they want people to know that there are alternatives here. They want people to feel concerned about the waste. And I think that their call to action here would be, could we use reusable hats? They say that they're the first in the world to use these hemp reusable hats. Well, could we be the second? Why aren't we also doing it? It seems like a really good idea. Perhaps only interesting to communication nerds like me, but their spokesman there is a sustainable sourcing specialist who's not necessarily a member of theatre staff. I would probably have tried to have a more relatable theatre staff person there to do the talking for that one. But I'll pop that link in the chat so you can all have a look. That is the end of your whistle-stop tour through communication around sustainability in the NHS, but I am happy to answer any questions. I'll put my email address in the chat as well, so if you've got anything, do feel free to come to me directly.
Fantastic, thank you so much. Wow, that was an amazing whistle-stop tour. I feel like there was so much to think about. I'm just going to kind of reflect myself on a few little themes that have come up while I give you all a chance to maybe think about the questions that you might have. The bits I've written down was I was really struck by the sort of theme of wanting to create a sense that everybody's responsible and everybody has ownership, and the idea that we co-develop things together, so as sustainability, and it becomes everybody's business. I felt like that was a theme throughout. And that theme of using the right language. So are you speaking to the clinicians? Have you even kind of knuckled down into what sustainability is and made sure that everybody understands? And I know particularly in the hospice sector, sustainability as in financial and business sustainability is out there as a concept. So kind of drawing the distinction between environmental sustainability But then if you have to say environmental sustainability every time, it becomes quite unwieldy. So how do we shorten that and make it easier to talk about? And then I really liked the concept of what's the problem we're trying to solve. And we kind of know that the problem we're trying to solve is, saving the planet. But how do you bring that down to a specific, what do we know, where are we at, what are we trying to change, and what do we want people to do? I thought that was really fascinating. Now, if no one's going to volunteer a question, I'm going to pick on someone. Now, there's one of our pilot schemes, and I hope there's a representative here, who do an amazing thing called a trolley dash when they do teaching. And I don't know if they're here. So if they are, someone's hand's gone up, so maybe that's them. Go ahead, tell us about your trolley dashing, or if it was a different question, go ahead.
No, hi, I'm Rachel, one of the specialty doctors at Southampton General.
Hi.
Yes, we do trolley dashes where we take a trolley with information leaflets and sweets on, and we target wards who we may have identified need support in additional areas, but there's no time for formal teaching. So you just capture people on the ward and say, for example, we did one on advanced care planning, or we did one on just in case medications, and people can just come and ask questions. You're not there for that long, but they can come and ask questions while you're there. We do some little quizzes to see what the ward staff know. It's probably more the nurses that we target than doctors, but yeah, seems to work well at the moment.
Thank you, Rachel. Thank you for sharing that. I remember hearing about that and thinking it's such an exciting way to think about how Liz says, who is your audience and how do you find them? And you found a way to say, well, our audience is the ward staff, and how do we find them? We have to go to the ward, and they haven't got much time. So we take a trolley and we dash. And also it sounds fun. Like, to me, that sounds like an entertaining way to engage. Liz, go on.
Yeah, we have trolley dashes, which are fantastic, but we also, some of our team have a really cunning plan of setting up outside the restaurants just before lunchtime. So they set up a lovely stall, they have sweets, they have things to give away, usually pens are quite popular. And they engage people that way. You kind of can't avoid them because you need to get past to get your lunch, and they're there going, no, but do you know about IPC, or do you know about whatever awareness week we're talking about that week? And it's a really effective way to meet people that perhaps aren't reading their email every day, aren't sitting at a computer, are super busy, and just grab them for 3 or 4 minutes, give them a sweet, give them some information, and they remember it because it's engaging and interactive.
Thank you. Is there anyone else from our pilot sites who would like to share a bit about maybe how you've communicated being part of the pilot scheme, trying to achieve your award level, sort of good and bad, any lessons learned? Oh, and Liz, we can still see your slides, by the way, so you might want to just stop sharing. Be quiet.
Oh, Kate, hi, it's Kate at York, St
hi,
Leonard's
Kate.
Hospice. Hi. Sorry, I joined late, but what I've seen so far has been so fascinating, and especially the clarity of communication really up my alley. So Kate and I were on a Teams meeting last week talking about our progress with the pilot project, but I sat in on a nutrition and hydration group this week and introduced the 7 or so elements within the framework relating to food. And I've already had an engaged nurse come back to me with an idea about a project she wants to do to monitor and make improvements. So I think it is that, obviously we're way smaller than any big NHS trust, but it is that in-person communication that really seems to land. And I got buy-in from the group for the scrutiny of the waste streaming and some of the frustrations that I'm coming up against. So I just think, if in person, I'm up for bribery as well, so I'm going to get some sweets and pens and see if I can bribe people and persuade them to engage on their lunch break or coffee breaks. So this is really fascinating, so thank you everyone.
Brilliant, thank you. Thank you for sharing that, Kate. And Steph, I can see you've got your hand up too.
Hi everyone, I'm Stephanie. I'm one of the palliative care consultants at Guy's, and we're another Guy's and St Thomas's, and we're another pilot site. I was just going to reflect. I agree. I think a lot of people maybe don't fully read the emails or miss the emails. So trying to think of other ways to keep reminding people that we're, working towards this award. I'm sort of trying to potentially leapfrog a little bit on other people's. So every time something happens, for instance, we're going to switch from paper to virtual ward lists soon. They're mainly doing this for other reasons, actually, but just continuing to say, this will be great for many reasons, including for sustainability. So every time there's something that may be slightly linked to sustainability, just reminding the team of the impact it will have there. But yes, I have to admit, emails often get ignored, and I'm trying to avoid printing out loads of posters because of the paper waste, but then sometimes posters are the way to go. So I'm struggling a bit there.
Yeah, the challenge of being green, right? How do you manage those conflicts? Karina.
Hi, so in our hospice, we were teaming up with our marketing team to get messages across in infographics on screensavers within our hospice. So that on Day of Sustainability, any schemes that we're starting within the environmental sustainability group, we ask our marketing team to prepare an infographic and put it as the rolling screensaver as part of the hospice.
Interesting. Thank you for sharing that. And I know Liz will probably say that within a big NHS trust, that's quite challenging because there's so many things, but perhaps in a smaller organisation that feels a bit more possible. Yeah, really interesting. Okay, anybody else got comments, questions? Actually, while you're thinking, I was really reflecting on what Joe was saying. So we often talk about triple bottom line, don't we? So patients, the way I remember that is patients, people and pennies. I think I tend to talk about cost in terms of cost saving, but I noticed that in Joe's infographics, it was health service. So yes, you're talking about cost saving, but you're also talking about, improved capacity to see patients or a better service delivery. And that actually, if you're talking to clinicians, that might be much more meaningful. Yes, there's a budget, and yes, if you're a certain level of management, you might be worried about cost, but actually talking about our service will run better because that is a subtle shift, but I really kind of took that on board. I'm thinking about how I communicate that, and particularly then linking to what Liz was saying about which audience. So yeah, really fascinating. Keith, go for it. Oh, you disappeared and I can't hear you.
You're on mute.
Sorry, can you hear me now? Sorry. Yeah,
Yes,
Keith Gray, I work with the Getting It Right First Time programme with Joe work. I think the two of the key things that sort of reflecting on what everyone said is sort of identifying co-benefits, which you've just said, and also co-development right from the start. We're working with our partners. We're trying to get a national message across, so rather than it just being at a trust level or a hospice level for some of you, it's a national level, and we don't really have the capacity to go into every single trust in the country on a regular basis. So it's using, if we co-develop things with people, then they're much more likely to promote it locally as well. So co-development, I'm working with partner organisations who can do that communication for us as well is really important. So co-development and identifying co-benefits is probably two key elements of our approach.
Yeah, brilliant. Thank you. All right, lovely. Well, it is 5 minutes before the advertised end. I will let you all gradually go away because I know you've probably got other meetings to go to or clinical work to get back to. Thank you so much to all of our speakers. That was really fascinating. And just making the links between the different ways you were approaching it and seeing those similarities, that was really fascinating. I feel like I should have prepared and asked, what do I want you to do now? And I haven't. So I'm coming up with one. I'm hoping everyone on here is signed up to our Palliative Care Sustainability Network. If not, go to the Centre for Sustainable Healthcare's networks page and check us out. I will pop our email address into the chat. And again, we have a mailing list that I run from our Gmail account. So if you're not already on there, you can email me and ask to be added to the mailing list. We will have another sharing practice session probably realistically after the summer, which I think is going to be on issues around prescribing and waste from pharmacy, because that's the kind of next most asked topic at the moment, but also open to suggestions for other things that our pilot sites are sort of having great successes with, that they want to share, and also that they're struggling with and might want to hear from other places how they are negotiating those challenges. So yeah, please do let me know if there's anything you particularly like a sharing practice session on. And otherwise, I will let you all go and get on with your days.
Thanks all.
Thank you very much.
Yeah.
Mm.